34th week of pregnancy. Does your baby already have the smoothest skin, with a note of extra fat, which we call brown fat, and which helps him control his temperature when he comes to this side of the uterus? This is one of the news I highlighted for you, but there is more news about your baby, some things I need to talk about you, your discomforts and hunches that are already happening. There are feeding tips and a tip, the checklist I prepared about the baby's room, and some things you need to prepare for this week. You know what? Stay with me and I'll tell you. Hello, I'm Monica Romero. I'm thrilled to have you joining in celebrating a chubby baby now at 34 weeks. Calm down, there's still news about pregnancy. Leave my home too, see? Stay here with me. And now let's talk about your belly. Look what a beautiful thing, your useful one. It's already being felt about 6 inches above the navel line. And when it is, you have this uterine expansion. Our organs rise, the organs rise, we can no longer expand so much. The lungs give you a little shortness of breath, increased reflux and heartburn, unfortunately. So we have to maintain that light meal routine, eating a little more times a day to feel relieved and avoiding eating anything spicy, heavy or very acidic at night. And one of the complaints that we are starting to have now, increased because we already had them before, is insomnia. And insomnia comes because it's difficult to breathe, because the belly doesn't let us find a very pleasant position to sleep. It also happens because we have more reflux and heartburn, because we get up all night to pee on ourselves, and also because of anxiety. So what will my birth be like? Am I afraid of childbirth, huh? Shall we talk about that too? So we have to start removing some of the ghosts of the night, right? Leave them far away so you can sleep. And how do we do that? We do it by taking a notepad to bed, so when something comes up, we write it down to get it out of our heads. We do a sleep routine, avoiding screens, everything that makes us very excited, that makes us very euphoric during the night. A movie, 11, screen, a little game. All these luminosities in the eye makes ours so. Sleep go away. A relaxing bath is important. Warm with the hot water hitting the back that are already sore. Let that hot water hit a little on the back. Do a routine by applying moisturizer, oil on the belly, talk to the baby, give a few swings that they love. And then we'll try to promote it, right? A preparation for sleep. And our body's already preparing itself. Another complaint that we have a lot now is pain or numbness in the hip. Why? Because our joints are getting soggy, right? Enlarging our pelvis for childbirth. This can cause pain, numbness in the hip, including difficulty walking. But if this pain is intense or bothering you, it's better to tell your doctor, okay? No intense pain is normal in pregnancy except labor contractions. But they have to happen later, right? Let's hold on a little longer. And about labor pains, it's normal for contractions to increase, okay? Now at 34 weeks, you will feel more contractions, most of them not painful yet. And if you have more than 4 contractions per hour, is it better to seek medical care to see if you have a risk of premature birth combined? Here is a little list of the main difference that we have from contractions, Braxton Hicks, which are the training for true contractions. It seems that they are labor contractions, okay? All the images you will find there on my Instagram. You don't need to keep printing the video, just follow there. A Almanaque dos Pais and enjoy it. Already leaves a like on the video here for me. And now that you let me like it, enjoy it, already comments, have you done the ultrasound of the 3rd trimester? How was that ultrasound if you didn't do it? It should be to happen now between 34, at most 35 weeks. And what is evaluated mainly is the amount of amniotic fluid, placental grade. How big is your baby, huh? If his head, if the circumference is also adequate, including for a normal birth, the position of your baby, if he is sitting, if he is on his side, which is the transverse position, or if he is cephalic, which is that head down position, If he is already acephalic, the weight of the head, the fitting in the pelvis will no longer allow him to turn. It can happen, but it's really hard, okay? So we already consider that it doesn't happen anymore. But if he's sitting still, he still has up to 3,637 weeks to turn over. And the same if he's transverse, okay? If he has on the transversal, he also has a chance to turn up to 34 to 36 ka 37 weeks. So, no despair. If you want a normal birth, he's not in the right position. But it's important information right now for this ultrasound, and it's probably going to be an ultrasound with Doppler. What is this? You'll see. How's the baby's little heart? And the time we hear that wonderful tum-tum-tum-tum, listen with me. Oh, how delicious. When we listen, our heart even speeds up faster than the little ones, right? It's our emotion too. And even more emotion, you have your little baby on your lap in some week. And finally, when you go to bed, have you been able to sleep on your left side? No, yeah, tell me. It's normal for us to change positions during the night, or sometimes we can't even stay on the left side. Why do we say that this position is so important? We have several veins, and one of them had a vena cava. And when we are on the left side, it is a little more released, which allows better blood flow, reducing swelling, improving our circulation. But not being able to stay on the left side doesn't mean you're going to have a circulatory problem. It's not that if you get it, it'll be better. If you don't make it, it's okay too. Okay? Trying to stay on the left side when you are on the couch or when you are awake and still have your foot up a little will still help reduce the swelling even more. But this will not compromise your health or the health of your baby. And remember, insomnia affects around 70% of pregnant women. So getting to sleep turns out to be more important than forcing a position you're not comfortable with. And you, mom of twins or triplets or quadruplets or quintuplets, now my message is for you. So are you ready? Most multiples happen between 34 and 37 weeks. Then the normal birth is ready. It is possible when the two babies are upside down, but it is still more common to have a cesarean section in these cases, especially if there are more than two babies. Then you need to perform 11 cesarean sections for greater safety for the mother and also for the babies. But in this case, for you, what will change the most is that in addition to having more discomfort than everyone else, more back pain, more contractions, more urinary incontinence, you already have to have everything ready. Little room has to be there. It's ready. The maternity bags also need to be ready. The visits to the maternity ward to see where you will be born, how you will be born, the conversation with the doctor. All of this has to have happened already. So I hope it's already everything organized, he says. For me, if in your case, everything is already organized. If you're a mom of twins, I know there's a lot here in the Parent Almanac, and it's increased a lot, okay? Many people have realized that there are many more triplets in school. This happens mainly due to in vitro fertilization, of course. Many of them are natural. You do, don't you? Both identical and non-identical babies. But when you do IVF, even if it's just one egg, the probability of it multiplying and producing identical twins is higher than a normal pregnancy. Look at that interesting statistic. So, a mother of twins, you already have everything ready and prepared. If I don't have it again, I think I'll give it back a little more. But if I don't, I'll wish you a beautiful one. Now, for my favorite time, let's talk about your baby who has the smoothest skin, the plumper face with that brown fat that helps the baby control his body temperature. After birth, he's already measuring about 33 centimeters from head to butt, which will give 44.5 to 45 centimeters, considering the legs, and weighing around 2 kilo and 300 grams. These approximate measurements and weights let us know that our baby gained nearly 300 grams in the last week. What does this mean? It's the weight gain, the good fat he's acquiring to prepare himself, coming in chubbier. Still talking about your baby's skin, it still has a very thick layer of Vernix caseoso, that white substance, a little greasy, that stays on the baby's skin, and we notice it a lot when he is born, right? But we already know that Vernix doesn't just protect the baby's skin inside the belly, it protects too much here too. So it is already a recommendation that we do not give the baby the first bath right after he is born, that we keep Vernix on the skin longer. The small I wash only with water without using soap. Some women, instead of doing it just for 24 hours, choose to extend that time, right? To continue bathing the baby with only water to see how long you can keep Vernix on his skin. But it's natural that the contact, right? The friction with the fabric, with his own clothes, is already removing the Vernix. Since last week, your baby's immune system has started to work only in a better optimized way. And then you ask me, hey, but does he need an immune system inside his belly? Yes, despite the fact that the placenta is an incredible barrier to labor, viruses, germs, and other toxins. Even though he's not out here, not getting it through our air, he's also getting it through the placenta, which she hasn't been able to block. And since the placenta doesn't block everything, it trains your immune system at the same time that we need to remain attentive to medications that we can ingest and various other products, or even infections that can cross the placental barrier. But the immune system is already working there. When he is a baby, he will continue to train more and more. There's going to be a lot of things he's going to get in touch with. But what is the organism already learning? How does it work to combat all this? But the maturation itself will happen around the age of 5. That's why babies and children, especially school age, have up to 13 episodes of flu and colds, poisoning per year. That's more than 1 a month, and that's decreasing. It's not because he's tacked with less virus. It's because the immune system will get really mature there around 5 years of age. Until then, there's a little nose to clean, there's a thermometer, and wait until I'm going to talk about it to you in tip of the week. Is there a thermometer in my tip of the week too? And finally, your baby's eyes already blink, open and close easily. He is already mastering this technique. If by chance you put a flashlight in your belly, his first reaction is to run away from that light. He tries to stick his little head in there to hide from that light, but his pupil can now be seen growing and shrinking, trying to adapt now, huh? The amount of light he is receiving inside the belly when he comes outside, so much light that he is not used to, that it is even difficult to open his eyes. Look at this video of this newborn suffering to be able to open the little eye. But he will adapt, because now, from 34 weeks gestation, he already has the pupil working better. Your iris, although it is already colored, it still does not have the final color of his life, which will require sunlight for him to achieve the final iris color on the line. Feeding tip, I'll ask you again. There are 2 repetitions. It's good for you to avoid salt mainly. You only have to be careful about swelling and invest a little in natural coconut water, okay? It can't be. This is not industrialized coconut water. It has to be natural. The more natural, the better for you, because in addition to being a diuretic, which reduces swelling, it will also help you get rid of a little constipation. Coconut water is all good. I've talked a lot about her here because she saved my pregnancy a lot, and I want her to save yours too. And now on to the tip of the week. I have prepared a checklist of things for you to do, but calm down. You don't have to write down what I'm telling you. I will leave this image here for you, and you can also find it on my Instagram, which will help you in what you need to do. Come on. First thing, the baby's room is ready. So what you're going to do is take a doll, right? That's the size of the baby, or a stuffed animal, and you're going to walk around your baby's room to see if the traffic there is cool. Because if you bump into something, have something very tight, you still have time to adjust calmly. And remembering, okay, stuffed animals, niches, it's nothing like that. It's very cool in the baby's room. It has to be as clean as possible so as not to collect dust. It's not time to put it on the sheet yet. Blankets, you expect to come back from maternity for this, and the curtain too. If you chose fabric curtains, right, like voile or like cotton, you have to wash them at least once a month, okay? Those curtains were tight. These are easier for you to keep in the baby's room, but they are not always the prettiest. And crib kit is not recommended by the Brazilian Society of Pediatrics due to the risk of suffocation and also increasing allergies due to the accumulation of dust. They are beautiful, but not to use, not only to take pictures. Don't wear that, okay? And the baby mattress has arrived. It comes with a strong smell, right? It can stay from the protective plastic, and it is legal to leave in the sun for at least 1 day. Another checklist to start doing this week, huh? Did you wash the baby's clothes? Already washes the baby's clothes, all RN up to 3 months is also important to already leave. Washed can pass, can keep, short for him, do not accept, can already leave everything ready in the dresser and in the bags of the maternity they are ready, can leave ready. If the bag is smelling, leave it open. I left mine open until the day I went to maternity. I left it ready and open and with a little girl with all the documents, okay? There is also on my Instagram the entire checklist of the maternity suitcase, both yours and the baby's, as well as the companions, which many people forget about the companion and all the documents and extras that we cannot forget to take, but go to the checklist. Do you have a car? The baby seat is already installed. You can clean the car seat. It has those padded parts that can be washed, and you can also install it, and it's not easy to install. See? You should take a course to install a car seat and assemble a stroller, which is difficult. After we get it, we even do it with our hands behind our backs. But the first time is complicated, it's time for that too. But Fake List has already organized your baby's diaper changing box. First, you have to have diapers. But I'm not going to tell you to stock up because many babies have allergies to one brand or another brand. Sometimes we stock up and end up with a lot of diapers that we can't use. Buy a few units, that's if you don't go diaper tea, right? Buy a few units, a few packages for you to go testing and also see which ones you like the most. But in the box, you also have to have cotton. You have to have a thermos bottle with hot water so you can do hygiene. The ointment to prevent or to treat diarrhea, this who will indicate to you will be the pediatrician, okay? No, don't buy just any. You have to see which one is best for your baby and every moment of life too. And then you can put other items such as those cotton swabs, AK cotton swabs. You can also put a towel for you to dry the baby's butt after hygiene, after you clean it with cotton and water. If it gets wet, it can give rash, so we dry it. I was wearing a diaper instead of a towel, okay? Those better diapers, I like them better. I think they absorb water better. But leave everything there, within reach, in the hygiene box. Hairbrush, I already told the moisturizer brush. If you like to pass the nail kit to cut the baby's nails. All this has to be in the hygiene box. Then in the bathroom, there will be another box. I'm calling it a box, but it can be a drawer. It can be on top of the sink. It's just a way to organize, okay? There will be another one in the bathroom. What will there be? There is a neutral liquid soap suitable for your baby. If you want to use a shampoo, also has to be a proper one for newborns, okay? It doesn't work yet. It's for big kids, no. And the ones that won't hurt. The eyes have to have cotton swabs again because we end up using them. You have to have cotton balls to clean the baby's eye, which we do right at the beginning and leave the baby's towels already prepared, separated, because sometimes you use one, he poops, so you have to change it. So you always have to have two there for an emergency. And if you are not sure about the temperature of the baby's bathtub, a thermometer helps a lot. Then we get crazy. Put your elbow there and measure it. It's beautiful, but at first a thermometer helps a lot when we are a little insecure, okay? And finally, baby Monica's medicine box. Do I have to buy a lot of medicine? No. You don't have to buy a lot of medicine, but some things are important to have at home, such as a thermometer that I told you. You have to have a thermometer. It is important to have gauze plus cotton swabs and alcohol. 70% to clean the baby's navel is also important to have, and you can talk to the pediatrician about some other things you can have at home for a scare or suddenly due to a colic. But then only the pediatrician will be able to indicate to you the best medicines, but cotton, thermometer, alcohol, cotton swab, you can already provide this because everyone will guide you to have it. I really hope you enjoyed this video. If you liked it, don't forget to leave a like for me. See you in the next video.